Bismillahirrahmanirrahim. Assalamu alaikum. Welcome into the third episode of our vlog series on renal dialysis. Renal dialysis is a lifeline for millions, but it's just one part of the larger story of kidney health. Whether you are facing kidney disease or working to prevent it, remember, knowledge and support are powerful tools. In this video, we are going to dive deep into what renal dialysis is, why it is needed, and how it impacts the lives of patients. We shall also look at the different types of dialysis, how patients adjust to it, and the future of kidney disease treatments. Renal dialysis is a medical treatment that filters waste products from the blood when the kidneys are no longer able to perform this function. What are the types of renal dialysis? There are many types of renal dialysis, and these include hemodialysis, which uses a machine to filter blood outside the body. The second type of renal dialysis is peritoneal dialysis, which uses the peritoneum, that is the abdominal lining, to filter blood. The third type is continuous ambulatory peritoneal dialysis. It's a type of peritoneal dialysis which is done manually. The fourth type is automated peritoneal dialysis. It's a type of peritoneal dialysis which is done using a machine. And the fifth type is continuous renal replacement therapy. And this is reserved for critically ill patients. When the renal dialysis is indicated, there are four main indications. First is end-stage renal disease, when a patient's kidney are unable to function normally anymore. Second indication is when the renal dialysis is required is acute kidney injury, when because of some drugs or because of some shock or some other infections, the kidneys are acutely injured and they stop working. Third is overload of fluids and electrolytes because of any other disease. And the fourth indication is poisoning or toxin removal. God forbid if there is poisoning case of or some toxins in the body, so to remove that when the kidneys normally cannot do it successfully, so you need dialysis. What about the dialysis processes? First, the hemodialysis process, how it is, what are the steps of hemodialysis process, how it is performed. In the first step, there is excess creation when fistula, graft, or catheter is made on the human, the fistula is done on the left arm most of the times, the graft is done, the catheter is inserted. Second, the blood filtration through a dialyzer, that the patient blood is passed through a dialyzer machine. And in that machine, the third step is removal of waste products and excess fluids. And the fourth is in this way, electrolyte and acid-base balance is correct. So for hemodialysis, there are four steps. it has got the four components. One is access creation, fistula, graft, or catheter. Second is blood filtration through a dialyzer, that is a machine. Third is removal of waste products and excess fluids. And fourth is electrolyte and acid-base balance correction through the hemodialysis process. What about the peritoneal dialysis process? Again, it has got the four main steps. The first step is catheter insertion into the peritoneum. Catheter is inserted into the abdominal cavity. Then dialysites infusion into the peritoneum. The fluid is injected. Waste products removal through osmosis. Then it is again the aspirated, and it takes along with it the waste products and drainage of dialysate and replacement with fresh solution. So again, it has got the four processes, the four steps: the peritoneal dialysis, the catheter insertion into the peritoneum, the dialysites infusion into the peritoneum, then waste products removal through osmosis. They are from the body, they are collected in that by the process of osmosis. Automatically, they get collected in the fluid, then drainage of dialysate solution and replacement with fresh solution. What can be the complications of renal dialysis? There can be many. For example, infection, excess site or peritoneum, where the fistula has been, the catheter has been inserted, or for the hemodialysis or for the peritoneum. Then the blood clots, blood clotting is another complication. The hypotension, the patient can go into hypotension, muscle cramps, they had because of this change in the electrolytes. Electrolyte imbalances, it can happen, and dialysis related amyloidosis. This is a long-term complications in which the organ starts failing. So the complications, I repeat: infection, excess site or peritoneum, the blood clots, third, the hypotension. The fourth is the muscle cramps. The fifth is electrolyte imbalance. And the sixth is the dialysis-related amyloidosis. And any patient undergoing renal dialysis, or the family whose family members undergoing renal dialysis, they need to know that these 4 or 5 complications can happen, and they should be mentally ready for that. What about the dietary considerations for patients who undergo renal dialysis? Of course, there are a few dietary considerations. One is fluid restriction. So the load on the kidneys is minimized. Second is protein restriction, not absolute restriction, but to the allowable amount. Third is electrolyte management, potassium and phosphorus in special. And fourth is the vitamin and mineral supplements. So any patient undergoing renal dialysis, we need to take care of the fluid restriction, protein restriction, electrolytes management, and especially the potassium and the phosphates, phosphorus, and of course the vitamin and mineral supplementation. Share it with your friends and family, because raising awareness about kidney health can change lives. Let's work together to make sure no one has to face kidney disease alone. Take care of your kidneys today, and let's continue to support those living with dialysis every step of the way. If you like this video, do subscribe to my channel to get vlogs, updates, and videos on other health topics as well. And also, I'll request to share it with your family, friends, with your colleagues, with your relatives, to help me in the aim or the target to create public awareness about common health diseases in our country, Pakistan. Take care. Khuda Hafiz.